Now, the intense rush for COVID-19 testing is not letting up. We know how frustrating it can be to find testing, so we are trying to make it easier. You will see a QR code pop up in the corner of your screen. You can scan it with the camera on your phone, and it will take you to an interactive map to find testing sites. Earlier today, we saw around 100 cars snaking around the parking lot at Lakeside Mall, all waiting in line for drive-through testing. Others are turning to at-home rapid tests if they can find them. But when those results come back positive, they are often going unreported to local county health departments. 7 Action News reporter Simon Shaquette is going in depth tonight, pushing our state and local health departments for answers and exposing what's being called a major concern.
As millions of at-home test kits fly off shelves around the country amid the surge of Omicron, experts say there is growing concern about accuracy of COVID-19 case counts from the state and local health departments. Birmingham native Christopher Shea says after experiencing symptoms New Year's Eve, he took an at-home test and learned he was positive.
The at-home test was certainly helpful because the day that I took it, I don't know if I had the energy to go to another urgent care either.
Being vaccinated and already receiving a booster shot prior to this, Shea then took all the CDC recommended steps, including quarantining, notifying his employer and anyone else in close contact. But after calling his own provider and the Oakland County Health Department, he was surprised to find they did not have a portal to self-report, only a general email option on their COVID page.
A portal or something, and that's something that I think this is a great story because I don't know if that's talked about enough, how to self-report to make sure everybody knows exactly what's going on.
We checked with Oakland, Macomb, and Wayne counties to ask if any of them have a system to track positive tests taken at home and to include them in their stats. All three said no. Macomb County Health simply urges those who test positive to take a PCR test. Oakland says they have no mechanism to include the data. And in part of a statement, MDHHS simply says, call your local health department.
The more accurate, the better, right? So anything we can do to increase that number would be important.
Oakland University professor of foundational medical studies, Dwayne Baxa, says it's no secret many are skipping a long wait at testing sites that report data officially. But accuracy issues are also sometimes fueled by confusion.
Today, the CDC says this, and next week, the CDC says that.
We also asked Beaumont Health Director of Infectious Disease Research, Dr. Matthew Sims, for his view.
With these huge numbers that we're quoting of positivity, et cetera, we're underestimating it because there are so many positive tests that we just aren't accounting for. It should mention that at-home testing is not included in these numbers. This is just testing through healthcare systems.
While some at-home test kits do offer their own reporting option, Shea is emailing in his status as a way of doing his part.
I think it's best to get the best information. I mean, that's how I would view things in my life and my line of work.
He agrees public policy should be guided by the most up-to-date information available, considering the countless lives at stake. Simon Shaquette, 7 Action News.
Certainly so very important. Thank you so much, Simon.